And the panelists for joining us today. I apologize for the technical difficulties that prevented me from getting on promptly at 1 o'clock. So thank you all for your patience. This afternoon, we would like to discuss a committee report that was released today that highlights conditions at ICE detention facilities. The committee finds that these facilities are failing to meet appropriate standards and that oversight programs at the department are failing to identify and correct those deficient conditions. This forum could not be timelier. Just last week, a whistleblower submitted a complaint to the Department of Homeland Security's Office of Inspector General, alleging that a detention facility failed to adhere to protocols designed to prevent the spread of COVID-19. Even more alarming, the whistleblower complaint stated that detainees were subjected to hysterectomies without their informed consent. These allegations, if confirmed, are not only horrifying, they would constitute human rights violations. This committee is going to get to the bottom of these serious claims, and the Office of the Inspector General must thoroughly investigate them. Unfortunately, this is not the first time disturbing allegations about inadequate medical care and unsanitary conditions at ICE facilities have come to light. That's why committee staff visited 8 detention facilities across the country over the course of the last year and spoke with more than 400 migrants held in detention for this report. The report documents 3 major sets of issues at these facilities. Issue 1, ICE detainees frequently face deficient health care. Issue 2, facilities often abuse the use of segregation, which is commonly referred to as solitary confinement. And issue 3, detainees face challenges accessing legal and translation services and often fail to receive basic information about their own immigration cases. To discuss the report's findings more in depth, I am joined today by 2 of my colleagues on this committee, Representative Bonnie Watson Coleman from New Jersey and Representative Nanette Baragan from California. Both are tireless advocates for the humane treatment of migrants, and I look forward to hearing from them today. We are also joined by 3 experts who will share perspectives on the systemic issues in ICE detention facilities and discuss ways these facilities can be reformed. Dr. Scott Allen is an expert medical advisor at Physicians for Human Rights, who recently sounded the alarm on ICE's failure to prepare against COVID-19 outbreaks. Dr. Dora Shariro is a former senior advisor on ICE detention and removal issues to former DHS Secretary Janet Napolitano and a stalwart advocate for ICE detention reform. And Ms. Laura Rivera is an attorney with the Southern Poverty Law Center Action Fund and a firsthand witness of the unsafe conditions at ICE detention centers in the South. Dr. Allen, Dr. Shariro, and Ms. Rivera, thank you so much for your time this afternoon to discuss these issues. And now I would like to turn it over to my colleague and friend, Representative Watson Coleman, for any opening remarks.
Thank you, Congresswoman Rice. Thank you very much for bringing this forum together for this very timely and important discussion. It is good to also see my colleague from California, Ms. Baragan. Thank you to our expert witnesses today. I look forward to hearing from you. This is a very troubling time, and I have to tell you, my heart has been broken by some of the things that I've read over the last couple of weeks. I'm definitely very concerned about what we heard from the whistleblower Dawn Wooten about the barbaric treatment of detainees at Irwin County Detention Center in Georgia. And if these allegations are true, this is really probably one of the most inhumane things I have heard coming out of an administration that I think has very little bottom to its low. Across ICE's facilities, our committee has long decried the conditions and the treatment of the people that have been detained. It's one of the reasons we're here for this forum today. The complete inhumanity at Irwin, as I said before, was a new low, but ICE has also failed across the board. In fact, with what we do know about other facilities, it's possible that the only thing standing between us and another such revelation is another whistleblower or the appropriate staff and oversight that should be taking place. For example, right here in my home state of New Jersey, at the Essex County Correctional Facility in Newark, The DHS Office of Inspector General uncovered moldy food, decrepit bathrooms, and other egregious violations of detention standards. Even though the report that was done by the committee says that the facilities that they looked at were basically clean, they also had 2 weeks' notice to be able to clean up as much as they could. And even with that, there were still indications that things were not up to oil, as well as ICE employees refusing to let members of the committee see all of the rooms, go through the rooms. Nearly a year ago, I heard testimony as a member of the Oversight, Management, and Accountability Subcommittee about ICE's failure to provide effective oversight of its facilities, either directly or through a contractor that seems to have been woefully inadequate the entire time that her organization has had that contract. I hope our panelists today can provide more information about the conditions that are allowed to fester and the harm done to detainees when ICE oversight fails. These are human beings, people's children, people's parents, people with hopes and dreams, people, period, who came here seeking safety, security, a better way of life. They came to the United States of America and what it stood for. We cannot let these despicable conditions that we are seeing now, reading about now, and encountering now to exist any longer. ICE is broken, and we need to figure out how to fix it. Thank you again, and I yield back, Congresswoman.
Thank you so much, Congresswoman Watson Coleman. Now I'd like to turn it over to Representative Nanette Baragan for any opening remarks she would like to make.
Well, thank you, Chairwoman Rice, for holding this virtual forum on an issue that's so very upsetting, concerning, and unfortunately very timely. Last week's disturbing reports of the lack of medical care and of unnecessary medical procedures, like forced hysterectomies on immigrant detained women, left me feeling shocked and disgusted. What is happening is heartbreaking, and if true, is wrong and a crime. And unfortunately, this is only the latest in a long list of actions and wrongdoing perpetrated by ICE and this administration. The government has failed these women and it has failed families. So we have to get to the bottom of this and hold people accountable. And to start, we need to take a look at these private for-profit detention centers. They constantly fail to meet basic standards of care for their detainees and demonstrate an indifference to the mental and physical care of migrants in their custody. It's so great that we have a panel of people who are on the front lines, who bring experience and perspective that I think could help us, as well as those representing some of these migrants. And frankly, it would be hard for us sometimes to know what is happening if they were not there doing this work and informing Congress. So I'm looking forward to hearing from our panelists today and hope we can come up with some solutions on how to provide the oversight that's necessary to put an end to these inhumane practices. And with that, I yield back.
Thank you, Congresswoman Baragan. Now I would like to open it up to our panelists to give a few opening remarks as well. And I'd like to start with you, Dr. Allen. The floor is yours.
Thank you, Chairwoman Rice and committee members. Thank you for inviting me to comment on your report. I'm a medical doctor with over 2 decades of experience in correctional health. I'm Professor Emeritus of Medicine and former department chair at UC Riverside School of Medicine here in California. In the past, I served as a state medical program director for the Rhode Island Department of Corrections. I'm the co-founder of a Center for Health and Justice Transformation at Brown University. I currently serve as a court-appointed monitor in California for the Riverside County jails. Most relevant to our conversation today, I do serve as a medical subject matter expert for the Office of Civil Rights and Civil Liberties in the Department of Homeland Security, although I must make it clear I'm not speaking on their behalf. Since 2014, through multiple on-site inspections, my colleagues and I have documented problems with the medical and mental health care in immigration detention. And while the vast majority of that work is done quietly and behind the scenes, we have made protected disclosures to Congress concerning substantial and specific threats to public health and safety. In particular, we alerted Congress in 2018 about significant systemic problems in providing adequate medical and mental health care to children in detention, including the unavoidable risk of harm to the children inherent in the detention itself, as well as systemic problems in providing care. Among the systemic problems we identified, problems with access to translation, access to adequately trained providers, and lack of trauma-informed care were cited. We also cited actual child injuries, misdiagnosis, and errors in medical dosing. More recently, early on in the COVID epidemic, we very loudly and publicly alerted DHS and Congress of the imminent threat to detention facilities and made urgent recommendations, including things like population reduction and decrease in detainee transfers between facilities. And in spite of our very early warnings, there have been at least 5,810 total cases reported by ICE in their facilities. And I think the most updated figure is 7 deaths. According to news reports, an outbreak resulting in over 300 COVID cases in Farmville in Virginia was a result of detainee transfers. I concur with the findings and recommendations of the majority staff report in calling for improved inspections, greater transparency, and better accountability and enforcement. When we detain people, we have an ethical and legal duty to adequately protect their health. In light of these documented failures to do so, we have a compelling obligation to urgently make corrections. And thank you again for requesting my input, and I'm looking forward to answering your questions.
Chairwoman, I think you're on mute.
There we go. So sorry. Thank you. Thank you. I think we lost Dr. Shariro for a second. So why don't we go to Ms. Rivera for your opening remarks?
Thank you, Chairwoman Rice and Representatives Watson, Coleman, and Baragan for convening this conversation. I direct the Southeast Immigrant Freedom Initiative of the Southern Poverty Law Center. Our team has given legal aid to hundreds caged by ICE in Georgia and Louisiana. First, my sympathies go out to the family of Cipriano Chavez Alvarez, the latest person to die of COVID after being caged by ICE. And my respect goes out to every person in ICE custody. Their voices matter most. As advocates, we've witnessed ICE and its private contractors routinely abuse people in their custody. During COVID, ICE has failed to follow basic guidelines to control the spread of the virus. ICE doesn't give people enough soap, masks, or even information about the virus in a language they can understand. ICE isn't quarantining the sick. Instead, it continues to transfer people across facilities. The result is thousands of people sick with COVID and at least 7 deaths. When people protest, ICE punishes them. At the Stewart Detention Center in Lumpkin, Georgia, agents of a private SWAT team hit a man in a wheelchair with 60 pepper ball bullets in an act of torture. Abuses like this and the disgusting harms against women in Ocilla, Georgia, alleged in a recent whistleblower complaint, must be seen in the context of a system designed to dehumanize. This system treats human beings as commodities to be exploited for enormous profit. Most Americans would be shocked to learn that millions in taxpayer dollars are handed out to private prison companies, regardless of their performance, in contracts called guaranteed minimums. This system subjugates mostly Black, Brown, and Indigenous people to maintain white supremacy in this country. It uses the shame and stigma of incarceration to justify its own cruelty, suggesting if those people are in jail, they must have done something to deserve it. Well, no one deserves this abuse, period. This system cannot be reformed because it is not broken. It is working exactly as intended. It is irredeemable. These prisons must be shut down now. And we must say, not in our name. Let's invest instead in creating a positive, not a punitive system, one that welcomes migrants to this country in an orderly fashion, sets out a clear and simple process to gain immigration status, and connects them to key institutions in local communities. Thank you, and I look forward to today's conversation.
Thank you, Ms. Rivera. And Dr. Schirro, if you'd like to make some opening remarks.
I certainly would. Thank you, Madam Chair, and good afternoon, Representatives Watson, Coleman, and Baragan, and thank you all for your leadership and participation. I appreciate this opportunity to speak with you. Your report cannot be more timely or compelling, and I concur with your findings. Yes, it certainly appears that ICE prioritizes the securing of bed space over the well-being of the people in its custody, even though it has determined most detainees present little or no threat to the public. I think that the agency's belief that detention is its best option is a cause of the conditions that your report documents, and ICE is incorrect. Today, ICE uses as many as 232 facilities in 46 states to house detainees, an unwieldy number for an able agency to oversee. The federal government owns only 7 and operates none of the beds that it uses. Instead, ICE relies on 100+ public and private providers. Additionally, there is little alignment between detainee needs and the facilities to which ICE assigns them. Forgive this expression, but beds and bodies. ICE dispatches people as if they're all the same. All too often, lower custody detainees are assigned to cells, and female detainees are housed to units with inmates. Those with elevated healthcare needs are sent to facilities with limited healthcare services. Detainees with problems are frequently misdiagnosed and mismanaged as problem detainees. Across the board, access to mandated services, including translation for those with limited English proficiency, as well as access to their case managers, is sorely lacking. Also of great concern, ICE frequently pays for beds that it does not use, and that was just mentioned. ICE guarantees a minimum number of filled beds at many of the facilities, including 4 in this report: Adams County, Otay Mesa, LaSalle, and Adelanto. Intentionally or otherwise, this only incentivizes ICE to use all the beds it has and the facilities to fill the rest. Additionally, to compensate the facilities unable to meet minimum requirements, ICE accommodates their limitations with 3 different sets of standards. All of them are based on correctional, not immigration case law and statute. And then as limited as they all are, its newest, released in 2019, has 11 fewer standards and appreciably less instruction than the others. They're going in the wrong direction. Immigration detainees are entitled to greater protection under the law than ICE provides. Conditions about which you have expressed concern, healthcare, segregation, and the like, in my opinion, afford less care than is required. This has not deterred the company that ICE uses to inspect its facilities to determine that all but 2 meet standards. Probably not. As your report points out, we know that this is not the case. Just last month, the GAO again called out ICE's deficiencies in its oversight of detention operations. This is my hope. ICE, a federal agency responsible for a national system of detention and alternatives, will hold all of its facilities to the same high expectations to which civil detainees are entitled. Anything less is simply not enough. Thank you. I look forward to your conversation.
Thank you, Dr. Schirro. So I'm going to jump right into questions and we can start the conversation. I'll turn it over then to my 2 colleagues for their questions. Dr. Allen, I'd like to start with you. All of us on this call, all the members on this call have been down to the border. We've been to these facilities. We saw how badly managed they were pre-pandemic when they were not dealing with this health crisis. So my question to you is, what are the significant failures that they did, working with the contractors, but, setting standards like Dr. Sharira just went through? What are the major failures that ICE engaged in? And I would also, in terms of handling the whole COVID thing, i.e. transfers, keeping people separated when they were testing positive as opposed to letting them commingle. And also of significant concern is the mental health aspect. What services are there for, especially for children who are, it's hard enough for them to be in a detention facility, but now with this whole COVID thing, if you could just touch on the whole mental health aspect as well.
Well, thank you for that question. There's so much, as you know, packed into that question. I'd like to start by saying something we've all started to talk about. Those of us who are intimately familiar with the immigration detention system know that it's immense, it's scattered, it's fragmented. There are so many different facilities trying to provide care. And for some time, owing to its structure, have faced challenges in meeting their own standards. I'd like to echo that the standards themselves could be improved. It's something we could talk about. So when COVID started to declare itself in the early part of the year, this is when my colleagues and I became enormously alarmed. We had intimate knowledge about the capabilities and vulnerabilities of the system in responding to this very great threat. And we felt obliged because of the danger literally to health, safety, life, and limb, not only of the detainees, but staff and surrounding communities. How detention centers as congregate settings can promote spread not only in the center, but through surrounding communities through employees coming and going. And we, as I said in my opening statement, made a very urgent effort to alert leadership that they really needed to do some dramatic things to try to head off the threat. As we well know, our main recommendations were not heeded, and the public record shows the outcome, that we've had a significant number of outbreaks. I'm glad you brought up mental health, and particularly the important and ongoing issue of detaining of families with children during the time of a pandemic. There's already very harmful health effects, immediate and long-term, that can affect developing children simply associated with detention alone, even if everything else about the detention is so-called perfect. Isolation from therapeutic community, the stress of indefinite confinement, and so forth. But you add to that being trapped in a congregate setting when everything we read says, get out of congregate settings, try to create social distance if you can't, isolate yourself within a household unit. That only adds to the stress. And I think anyone listening can only maybe pause for a moment and imagine themselves in that situation. It would be enormously stressful for you, and particularly if you were worried about your children.
So, I guess this is more of a comment, but maybe if anyone else wants to, any of our witnesses want to comment on this. It seems to me that regardless of what the immigration policy is of whomever is in the White House, pro or not, that we as congressional members with the constitutional responsibility of oversight of these federal agencies and how they operate should demand and institute a basic level of care that is not regardless of who, just a basic standard of care, right? Dr. Allen or Dr. Sharira or Ms. Rivera, if you'd just like to comment. Maybe it sounds like an overly political thing, but the treatment of migrants should not be subject to the vagaries of a political policy that could change as frequently as every 4 years. Dr. Sharira, you have to unmute.
Well, if I just might respond, from a medical perspective, you're absolutely correct. The standards are independent of politics. Medical standards are determined by the profession, by the evidence, by the science, but also by respect, professional respect for human rights and human dignity, as others have referred to. Those are woven into the standards of care, and which is why, as part of our response, tightening up and addressing the standards and make sure that we use standards that we would expect if our own family members were so detained, that it should be no less. Entirely separate and related to any other thoughts you might have about the purposes of detention and other issues related to detention. When we're talking about health care, mental health care, and safety, as well as public health, these issues supersede all of the politics or basic human rights, and there are medical standards that we use regularly every day in the community.
Dr. Schreier? Oh, you have to unmute again.
How's that now?
Great, now we got you.
Thank you. I worry so that ICE uses primarily correctional facilities for the detention of civil detainees. It really communicates to the public a sense of dangerousness, which does not exist. And the physical plant is also often the plan for managing people. When you take a low-risk population and you put them in high custody housing, and then you dress them out in jumpsuits, and you have them do standing counts 5 and 7 times a day, it's everything is upside down, and it perpetuates a perception with the public that allows that to continue. I think the groundswell would be more pronounced if there was a better understanding of the differences, and that's also why I emphasized the need to have standards that are not based on those that govern correctional systems, but that are suitable and consistent with the case law for a civilly detained population. Punishment is expressly prohibited. Period. Stop. And yet, so much of what the committee observed and captured in its report is nothing less than punishment. The extensive use of punitive segregation, use of punitive segregation without any due process, denying them medical conditions consistent with a standard of care, which is something you would receive in a correctional system, is denied them just by virtue of the combination of ignorance and lack of oversight that each of us has been describing this afternoon.
Ms. Rivera?
Yes, I think the main point here is that simply promulgating more detailed or higher standards on paper will not resolve the systemic problems of the ICE detention system. The facilities used are prisons. The economic incentive is perverse and increasing, centralizing wealth in the hands of a few corporations. That the oversight system is actually built to enable, not correct, deficiencies. And so putting ourselves in the shoes of people inside, I think, is the greatest experts to understand what it must feel like to come to this country seeking asylum, or to be here for years with your family and working, being a member of your community, and all of a sudden treated as subhuman and abused on a daily basis, eating rotten food, water that is not fit for consumption, charged $10 for a 15-minute phone call with a loved one, denied access to an attorney who can help. Your family tries to visit and they can't bring in pens and paper to help you with your legal case. An ICE deportation officer doesn't come to visit. You have no idea what's going on with your case. You don't know how to fight it. This is a sort of Kafkaesque setting that is commonplace in facilities across the country, and particularly from what I have seen in Georgia and Louisiana. And so really the obligation of the members of Congress, I think, is to look at that 30,000-foot view and ensure that we push forward a paradigm shift towards something more positive than we have now.
Ms. Watson-Coleman, do you have any questions?
Oh, yes. Thank you so much for being here. I read the report, the committee's report on this, and I was just struck by so many things. The fact that you couldn't get toothpaste or soap or a toothbrush unless you encountered a friendly guard when you were in need. The fact that you had to actually clean your space, yet there were millions of dollars that were being spent for just that purpose through the contractor. And the fact that they're using a contractor, Nakamoto, that every time we've had that Ms. Nakamoto in front of us, she's not been able to answer our questions. She doesn't really have a good understanding of what's happening. But the one thing that was consistent is that they aren't doing their job well. And I agree with you 100% that the facilities in and of themselves are the incorrect facilities to house people who are under civil detention. But I also don't understand, Dr. Shiroro, you said that that the federal government only owns 7 facilities,
That's correct.
but that it uses 100 and some private facilities, right?
As many as 232.
And you said that the 7 facilities that the feds own, they don't use?
They're filled, but they don't operate them. They use the private sector to run those facilities that are government owned.
So all of the facilities that house these detainees are run by private organizations with contracts from ICE, right?
Not exactly, ma'am. It's a combination of the private sector. There are 4 big groups, and then quite a few sheriff's departments and other forms of local law enforcement. But again,
Okay, they may be local or county government facilities, but they're operating with this with this relationship where the feds pay this money to house those individuals.
That is correct.
What percentage of the individuals, to your knowledge, and Dr. Allen and Ms. Rivera, you can respond to this as well. What percentage of the individuals that are detained currently do you think could be held accountable without being held in a detention facility?
I'll start. The majority are assessed to be low custody, and more instructive than that, ICE has another way of assessing people. They assign them a threat risk, and the vast majority of the population has either, according to ICE, this is them saying it, either present no risk to the public or low risk. And so that group, as well as some in the middle, are more than suitable for release. And I would argue release without conditions, and then only when necessary with alternatives to detention.
So other than just treating human beings as subhuman beings, and other than putting big money in the hands of big donors, what is the motivation then for these individuals being detained as opposed to being in the community, continuing to be productive, no threat to physically harming anybody, certainly no threat to going back to wherever they ICE thinks it wants to deport them, but they wouldn't come here in the first place. What is the motivation for treating these individuals as subhuman, as criminals, and with disrespect and disregard for their health and well-being?
My view is that ICE is fundamentally an enforcement agency. It has little expertise and, quite frankly, little interest in operating a detention system or alternatives to detention. But as enforcement staff, if they know that this individual is right here, and if their case starts to move, that they can then do something with them, that's expedient for them. It comes at great cost to us, and certainly at considerable harm to the population that's being held, but they're the ones that are in charge. There's not a lot of, there hadn't been a lot of research for a long time as to how much you can count on an individual who is released to report as required, and if necessary, report for removal if that's the outcome. There are increasingly very strong studies that demonstrate all the safety that the population presents, and that we can add to the extent that it's necessary. But even when ICE as an organization releases people to an alternative, it tends to over supervise them. It just loads them up, with electronic monitoring and lots of reporting, which is for the vast majority of them also unnecessary.
It seems to me that the Department of Homeland Security has one problem after another. In just about everything that, we've had an opportunity to have a hearing on in Homeland Security. And it seems to me that when we're talking about this particular issue, ICE has not been trained to do what is intended for these people who are detained civilly. Do you, Ms. Rivera and Dr. Allen and Dr. Schroer, do you believe that we need to eliminate ICE and start all over again? I'll start with you,
Yes,
Dr.
well-
Allen, and go to you, Ms. Rivera, and end with Doc.
Well, I have to just confess that is such a policy question that's beyond my area of expertise that I'm lending to this discussion in committee. But I will simply say that your report documents a number of the problems and human costs in the current system. We definitely have to work to address that. It's a really much bigger discussion than I could comment on about the structure of the department and how it should improve. But certainly in the area of keeping people healthy and safe, there are significant problems.
Thank you, Ms. Rivera.
Thank you. I don't see any other way to deal with the scale of the systemic problem here than to dismantle a broken, an agency that is working to suppress and cage Black, Brown, and Indigenous people. I think that, over the past several months during COVID, we have seen the human cost exacerbated by continuing to cage people in spite of scientists saying that we need social distancing. You asked how many people could be out of jail while their cases are pending. Well, if you look to the federal prison system, Attorney General William Barr himself ordered the Bureau of Prisons to conduct a top to bottom review of everyone in custody and to release people who had infirmities. That did not happen on the ICE side. Yet another sign that this agency is a political tool that uses migrants as scapegoats to advance the political aims of their very few. So how many people could be out of jail while their cases are pending? I would venture to say all. These are civil cases. The vast majority of people, the data shows, report to court, report to ICE, fulfill their obligations for their cases because they have an incentive to play by the rules. And the why, the question that you asked earlier, why is this done besides profit, and besides, to perpetuate the system, I think again goes back to this notion of white supremacy. Our nation is at a crossroads right now with Black and Indigenous and other people of color leading a charge to say enough is enough. We will not be over-policed. We will not be the target of a racist new Jim Crow system. And Michelle Alexander said in her book that mass incarceration has been the chief tool for the maintenance of white supremacy in the 20th and now 21st centuries. And this is just another example of that and another arena in which that logic plays out. And now most Americans are opening their eyes to the reality and insisting that we make real and substantial change.
Hope so. Dr. Ferraro?
Yeah, thank you. You know, we went tough on crime in the 1990s and paid a terrible price. And as corrections wised up and started to release lots of people, well, divert them at the front end and release them much quicker from, you know, once they were inside, all those beds opened up, and then ICE took them. ICE has not yet learn the lessons that that the criminal justice system has learned, not necessarily on their own. There are lots of litigation, but ultimately a lot of improvement on the criminal justice side of things. ICE does not have a critical mass of individuals in it capable of making evidence-based decisions about the risks that individuals do or don't present, and then arranging systems of supervision commensurate with their needs. I'll point out that Secretary Napolitano, for whom I served, had first had me as senior advisor, and then I had the great opportunity to open the Office of Detention Policy and Planning, and it was there that the system, as we are describing it today, could have been carried out. One of the first things that was changed in the current administration was the elimination of that office. So there needs to be, there will always be some decisions to be made, whether it's ICE or some other entity, but clearly one has to have an appreciation of immigration law. You can't just take corrections people and have them do this either. This is an expertise that needs to be developed. I'm confident there are plenty of folks, you've got 3 right here today, and many more out there that can create a thoughtful system that will be cost effective and fair. But that's gonna take some change from the legislature, if not from the executive branch.
Thank you. Chairwoman Rice, I'm going to yield back to you because I know I've taken advantage of your grace this year, but I hope we can have the chance for some more conversation with our excellent panels.
Absolutely. That's what this is all about. Thank you so much. Ms. Baragan?
Well, thank you all for raising these issues. I'm disturbed. I agree with Ms. Rivera on the concern of the for-profit private contractors. I think we need to find a way to put an end to that. We see report after report coming out from the Inspector General about deficiencies, and it just seems that these reports come out, but then there is no real way to ensure that they're correcting them and that there are consequences if you don't correct them. So then there's just this pattern happening over and over again. And then now, from what we've just learned this week, of uninformed procedures and uh, hysterectomies. I mean, it is just so shocking and appalling. And now we're seeing more deaths with migrants that we hadn't seen in the past. And so it just seems to me that what we're doing isn't working. And oversight that's being provided, um, while we can call for another investigation, it just doesn't lead to consequences. And I think that's kind of what people, at least that I talk to, say, what more has to be done before we shut them down, or what more has to be done before there's real consequences. Um, Dr. Shiriro, in a report that you authored in 2009 for former Secretary Napolitano, you discussed 7 buckets of issues that have plagued ICE detention, particularly on the lack of oversight of these facilities. ICE has implemented some of the measures you recommended, but as found in the report, those oversight tools frequently miss deficiencies and leave them um, uncorrected, really. Can you speak more to this issue and how oversight measures can better be utilized to ensure the deficiencies are corrected? And, are those recommendations going to put an end to this? And outside of ending the use of private contractors, how do we get there? Because I think that is the bottom
Yeah.
line. How do we really stop this?
Yeah. Thank you for the question. And you actually used my language. I always talked about the buckets. So I'll go to one of the first buckets, which is really creating a strategy for the people that may be in the custody of the government, whether and I use custody broadly, so I'm not just talking detention, but anyone who is awaiting a proceeding before the immigration courts. ICE is missing many things, and one of them is a bed plan. That's a correctional term, but it really speaks to how many people are you likely to have? What is the continuum of control from nothing, which I've talked a lot about, to someone who might need to be confined, and then confined under what conditions? ICE has been in existence 18 years now, and he has not done anything but reach out to available beds that are nearby or far away and pay whatever they have to pay to acquire those beds. As I described it, they have a situation that's next to impossible to manage. 232 facilities, 46 states. You've got it's well over 100. I just couldn't count them all. But you've got these big private prison providers. The four big ones are just four in number, but they manage over 60% of all of ICE's beds. Just focusing there, where you only have to command the attention of those four agencies, you can achieve a really big impact fairly quickly. You need a team with experts in the field of medicine and other places to, be specialized and look at each of those areas. But I believe that you can move quickly. We did move quickly in the time that I was there. Unfortunately, a lot of the things that happen unravel, and so we have to round them up and do them again. An example, Nakamoto was in place when I was there, and their services were terminated. When I was there, it was actually a decision on the part of the procurement officers that all the inspections would be announced daytimes, business days, business hours. These are people who have expertise in procurement, maybe, but they have no expertise in the actual subjects of the goods and services that they're procuring. And so that was reversed immediately. And as I read in the report, that had been undone as well. So this requires continuous oversight. On the accountability side, having good information real time available on the website is critical. And ICE is not forthcoming with the information that it provides. I was pleased to see, as a result of an appropriations amendment, that there is new information that's on the DHS website that hadn't appeared previously. That's where I was able to get my information, for example, about guaranteed minimums. I knew that it existed, but now I can see which facilities have guaranteed minimums. But even now, ICE does not indicate what is the bed capacity of each of those facilities. And every conversation begins and ends there. When you're talking about COVID and social distancing, and they talk about having reduced the numbers, that does nobody any good if they're still keeping housing units filled and then just leaving some empty, which is only increasing the profit of who's ever operating those facilities. So I tend to be optimistic that a lot of things can happen quickly, but you need to have them happen quickly.
Well, thank you. I think it's really important that we remind the public that it is legal to come and apply for asylum. It is legal to come to this country, to go to a port of entry, and to apply for asylum. And what we're doing then is we're either turning people away these days or putting them into these facilities that are really prisons. I mean, I remember visiting the first detention center, and I said, what's this prison called? They said, oh, it's a detention center. I said, you can call it what you want to call it, but it looks like a prison. You walk in, it feels like a prison. And to some degree, these migrants are treated worse than prisoners, where at least there's some accountability, there's access to counsel, in our American prison system. So it is completely an effort. And I think under this administration, they have admitted they're doing whatever they can to deter. And that sometimes includes inhumane practices like separating children and parents. And even when members of Congress go to provide oversight visits, they're given notice. I don't think they should have to receive any notice. I feel like I should be able to walk up same day, show my congressional ID, and walk in and do an oversight visit. And worse, sometimes we get to these facilities and they don't even want you to talk to the detainees. I'm like, what is there to hide? If you're doing everything on the up and up and they have nothing to complain about, like what, I mean, what is the
Mhm.
issue here? That continues to happen to members of Congress when we go to these facilities. It's, well, we don't want you to talk to the detainees, or you need to make an appointment, or you need to talk to their lawyer first. There's always something. And it feels like, and it looks like a prison. There's just no other way to put it. And then when you hear about the practices of segregation and punishment, um, it just seems to be completely backwards and not what was intended. So I'm going to yield back, but do hope we can continue to have more questions and comments.
So I just open it up for, if any of my colleagues have additional questions or any comments. I mean, look, I think that how migrants are treated is a statement of us as a country, right? I mean, it's at its most basic core principle. But what I have found particularly frustrating is something that Nanette just hit on, and Bonnie also talked about, the constant pushback that we get from any kind of oversight whatsoever. They just won't show up at hearings. They won't produce documents. We've had to issue more subpoenas. We just, on another committee, tried to subpoena the acting head of a federal agency who just didn't show up. And then the answer is, okay, what are you going to follow that up with? Are you going to hold that person in contempt? That was my vote, because otherwise, what's the purpose of issuing a subpoena if you are routinely going to allow an appointee who's acting, has not even been confirmed by the Senate, to just walk all over our oversight responsibility like that? So, but this whole concept of like holding these migrants, all of whom have been rated at no or very low risk in these, prisons, basically, is just so wrong-headed. I don't even know how you get away from that. That just seems like such a Herculean task. I don't know if anyone has any thoughts about, like, what do you create in lieu of that?
Well, I would love to address that point. I had the opportunity to work over the last year with a terrific group of advocates anchored by the Detention Watch Network on a research project around what Americans think about immigrant detention. What do they know? What don't they know? And what alternatives are out there that Americans would really support? And the findings revealed that most people are shocked to learn about the conditions that we have been discussing here today. They have no idea, because the lack of transparency and the euphemisms in processing centers and the veneer of law and order language really obscures the reality of this torture that is routine in the system. And once people know, I think the fear that we have to engage with in the American public as a result of this campaign of hatred and criminalization, the fear that we have to work with is by presenting an alternative that says, look, as a federal government, we have the capacity to create a working bureaucracy to manage large numbers of people. We do this through all types of federal agencies and state and local. And we can have locally based representatives who are assigned tasks like giving newcomers IDs so that they can move about and prove their identity and prevent danger and be able to be identified if they do pose a danger. We can have a well-staffed administration to go through the cases of people. We can have a set of laws and rules that are manageable, that are consistently applied instead of the current patchwork of the immigration courts with its myriad confusing laws and decisions that differ all over the place. So I think if we use our imagination and are guided by our values of welcoming the other and valuing the immigrants who bring so much to the richness of our country, there really are more constructive alternatives than incarcerating, surveilling and punishing.
One of the one of
Go ahead. Go ahead.
Oh, one of the first pieces of legislation I introduced when coming to Congress was prohibiting the use of for-profit and private prisons, because I think if you're going to use them, you're going to need a population for them, and so it sort of was counterintuitive to any kind of reform measure. And mostly we were talking about criminal justice reform, but it's extended beyond that now, as we see. Nakamoto has a $71 million contract with the Department of Homeland Security's whatever procurement office to continue to do these inspections. And it does not do these inspections well, even when it announces that it's coming to a facility weeks before it gets there. And then it does mention from time to time some sort of minor problems with the facility when there are major problems with the facility. And I think that an inspector general needs to really look into Nakamoto and how it does its job. I don't think you can hire enough people in an agency to do the kind of oversight when you're locking up people who don't need to be locked up and detained in the first place. I think that the policies need to change as it relates to that, but the policies and the laws need to be, and the standards need to be applied universally. Not different in Georgia than they are in Louisiana, and they are in Texas, and they are in Maryland. Now, Dr. Ferraro, you said there are the 4 largest facilities. If we just kind of like focused on them for a minute, maybe we could have some impact here. Is one of them, is one of the organizations LaSalle?
So what I was referring to, the facility providers, it's more than 4 facilities, but so LaSalle Corrections is one of the 4. Yes, ma'am.
And who are the other 3?
Core Civic. It used to be known as CCA, or Corrections Corporation of America. The third is MTC, Management Training Corporation, I think is what that stands for. And then and the 4th is the GEO Group.
GEO?
That's correct. GEO and Core Civic are the 2 largest. And
my understanding is that the LaSalle Group, that government had removed its prisoners from the LaSalle Group because of conditions. Is that, do you have that recollection?
I'm not familiar with that. I could certainly look at it for you. But it's a combination of either jurisdictions deciding to cancel contracts, or through reforms, as I was mentioning before, that they've figured out how to reduce their population so they don't need it anymore.
I have one last question, burning question. Not really, but I'll just go with this one last question. You take innocent people who are somewhat scared anyway because they don't have the right documentation and they're in our country, but they've been here a while and they're not causing any problems. And you put them in prison-like a setting, and they've been in that setting for months. Is that about right? Months?
Yes.
Longer?
In some occasions, yes.
Does it change their perception of themselves, their relationship with society, and so that when they are released because policies change, do they come back into society different people with creating different problems? And Dr. Allen, I don't know if you want to speak to that or.
Yeah. No, it's a terrific question and something that's foremost on my mind and my colleagues' mind all of the time. It's sort of a point a lot of the speakers keep returning to. We are talking about what we are doing to human beings. And there is no form of confinement that I'm aware of that is, therapeutic or helpful. Generally, all forms of confinement as it relates to immigration and law enforcement carry costs of mental health stresses, but also physical health stresses. We don't have to go any further than COVID, as well as other infectious diseases, to illustrate the adverse effects not only on the health and future health of the detainees, the staff, but also our communities. So from a health perspective, these programs are potentially very damaging to individuals, not just in the short term, but there's a rich literature on long-term adverse health effects of people who are confined. I can't comment on this without bringing it back to detaining children with the rich literature, the universal opposition of the entire medical profession, from the American Medical Association to the American Psychiatric Association, American College of Physicians, all the way on down. And the science on that is clear, but there's been a deaf ear in responding to the humanity of that, or to recognize the long-term costs and the cost of trauma on mental health and physical health. Doesn't affect just the people who were incarcerated or detained. It affects their communities and their families. Again, a rich literature on all this. So it's very distressing to watch all of this happen as a health professional involved with the system. I do want to take a moment to bring it back to where a few of you started in your open comments. Let's recognize that in this excellent report that I agree everything in, I want to point out that the Dawn Wooten, the nurse at Irwin, who made disclosures last week, is one mechanism that we didn't explicitly talk about in the report, and that's whistleblowing. And I think when we're talking about all the failures of the other mechanisms, this is when whistleblowing becomes important. I should quickly add that Dawn Wooten is represented by the same attorneys I am in my disclosures. That's Government Accountability Project. There's a firewall between us, but I should disclose that in commenting. But I salute, in principle, what she has done as a health professional, because when we say that government has not done a good job at meeting these basic human rights standards, it falls to professionals to stand up and speak their conscience and bring attention to violations of people's rights. So let's remember that, to the fact that we're now relying so much on whistleblowers to bring these problems to attention, is enough evidence of problems in the current oversight structure.
It shames me, it hurts me, and it angers me.
And that's a really good point, Dr. Allen. I want, there are three things I think that I've been trouble with this situation in Georgia. Um, well, there's a lot more than three, but three that I just want to see if we can come back to for a second. Number one is this concept of uninformed consent, that there's a language barrier and a language issue. Has there been any efforts or thoughts about maybe video recording some of these conversations to make sure that there is actual translation and informed consent? I mean, I think to when somebody's interrogated and it's video recorded, And so before you're going to go into a big procedure, why not just have a conversation with the person on camera? Is there some concern about that? Just to make sure that we have documentation that they knew what was going to happen and what they were told was going to happen actually occurred. Because unfortunately, we've seen in today's day and age that body cameras, law enforcement has helped reveal things that in the past, something was said and it didn't happen that way. So I'm wondering if there's been any conversation, discussion, or if there might be any use of ensuring that there is the language barrier goes away by maybe having some of these conversations recorded when it's such a critical decision like a surgery, so there's an understanding. Number two, Dr. Shiriro, maybe you can talk about this, is how the heck do we have doctors with questionable past providing procedures to people in these facilities that are government, they're under the care of the government, and we have the responsibility of them. Um, is there any process in place so that questionable doctors are not performing these procedures? And has there ever been a conversation about whether something that rises to this level of uninformed consent on what we're hearing in Georgia be considered on charging a crime? I can't imagine as a woman, I want to have children, and I come out of a procedure being told, by the way, you cannot have children now because of what we did, even though you didn't agree with it. I mean, that to me is a crime, and so I'm curious if maybe Dr. Shiro, you can start, and then see if we can hear from our other panelists on any thoughts on these.
Okay, so I'll start with your latter questions about doctors and nurses who have restrictions on their licenses. Everything begins and ends with ICE. They are ultimately responsible for the care and custody of all of these individuals, and it's largely their practice, as each of you have pointed out, that they hand them off to the facilities, have Nakamoto pop in once a year and say, that's that. And as I mentioned, Nakamoto, everybody meets standards or better. So there's an office within ICE. It's called ICE Health Services Commission and IHSC, and they deliver the direct health care at only about 22 facilities out of the 232. But they do establish some of the policies that are supposed to apply across the board. In my view, they do not do, they're not a stellar organization. So I'm hesitant to suggest that they should do more, but there should be individuals with expertise in healthcare embedded within ICE that provide oversight of all of the healthcare that is provided across the board. One of the things that COVID really brought out is that facilities went from having maybe a part-time physician or someone less, maybe 2 half days a week, to relatively large staffings. There are no expectations set, and this is a terrific deficiency on the part of ICE. And similarly, that it's not that you should just have X number of people, but as you point out, that they ought to be fully credentialed without any restrictions, without previous practices that would cause anybody concern about hiring them. The last thing I'll say about IHSC specific to this awful situation is they are basically like a cost control center of not necessarily the good kind. And so any kind of offsite visit that is going to take place must be pre-approved by ICE, by IHSC, except in extraordinary exigent circumstances, and perhaps Dr. Scott can jump in on that as well. And so their usual position is to say no, not yes. And so it's that much more onerous that some number of women have left the facility for offsite care. the procedure is known to ICE, even if it changes after the fact. And at no point does it appear that they're looking at it to spot, well, what is this this pattern that seems to be evolving? So for me, there are many more questions about not just what the facility and LaSalle as the provider is doing, but ICE, who's ultimately responsible. Where are they in all of this? And what is their response? What opportunities to improve do they see? And how quickly are they going to take them?
And I'd like to just follow up on that point. I not just related to ICE and all of the correctional detention work I've done over the years. Almost everyone now uses some hybrid of government and private contracting. And it's a common pitfall. I often have to remind people that you can contract out the work, but you can't contract out the responsibility. This is and this phenomenon also illustrates the challenge of these very complex systems. So when we're talking about care provided at facilities, there's care provided within the facilities by providers, doctors, nurses, and so forth, who work in the facility. And then when you get to emergency care, hospital care, subspecialty consultation, that in almost all settings is done offsite with community partners that these facilities negotiate contracts with practice groups and practices one by one. That creates, we talk about a system that's unmanageable. How do you assure quality? We can see how difficult it is to adequately credential staff who work within the facility full time. How do you possibly stay on top of the quality of care being rendered at all of your contracts? And yet you have a responsibility to do that. So that is something that needs to be thought about more, and solutions on how you would better guarantee that who you were sending someone to was qualified. But I do want to return to that first part of the question. The issue of informed consent is a bedrock of medical ethics. So this is not, we're not just talking about malpractice or something like that. We're talking about the foundations of the practice of medicine. And it is true that when there's a language barrier, informed consent is imperiled. The idea of videotaping a informed consent conversation between a patient and their physician carries one obvious problem, and that is that of confidentiality, that conversation needs to take place in a cone of confidentiality. That doesn't preclude that the patient could waive their confidentiality for purposes of recording the conversation. But now you have another problem. You have to get a doctor who doesn't have to take contracts with ICE and see their detainees, who says, I don't do this in my regular practice. I sure don't want to do it for you guys. I'll just stop seeing your patients. So it's a thorny issue. That solution might be harder to execute than it might first seem. However, there are ways of monitoring whether translation services were properly used. I won't go into detail, but those of us who audit facilities know how to do that. There's multiple levels to that verification process. And there also might be ways to make sure that there is some sort of person in an advocacy position. It should be the physician and the nurse in the facility who can guarantee that recommended procedures are indeed clinically indicated, and more importantly, that the primary doctors and nurses at the facility have themselves had an informed consent discussion about whether a procedure is really necessary.
Thank you.
Well, I could do this all afternoon, but we do have some time constraints. So I just want to thank all of our panelists. Any solution that we as Congress members come up with, we're going to rely on you and your areas of expertise, because you know how things should run. And we are all in a position as Congress people with oversight over these specific agencies to implement the changes that you have time and time again suggested. And you must feel like sometimes you're banging your head against a brick wall. Like, when are these people going to start listening to us? We know what changes need to be made. Now they just need to do them. And I'm hoping that that will happen sometime, next year. We'll get a better grip on, the treatment of migrants in our custody and begin to implement some of the changes that you've made. So I want to thank my friends and colleagues, Bonnie and Annette, Bonnie Watson Coleman and Annette Baragan, and all three of our witnesses. Thank you so much for taking the time. Again, I apologize for us getting off to a late start, but I'd like to continue this conversation, and we'd like to keep you all in this conversation with us. And we look forward to having those conversations sooner rather than later. And I'd like to thank the
Be
staff
delighted.
for putting together this wonderful panel. Thank you all for participating.
Thank you.
Very much.
Stay safe.